Since his election loss, President Trump has spent more time nurturing his delusional election fantasies than he has spent fighting the pandemic. Over here in the real world, COVID-19 is raging. More than 18 million have tested positive, and more than 322,000 Americans are dead. Hospitals across California are heading towards catastrophe. Intensive care units in the state have seen a nearly five-fold increase from just 2 months ago, right before the holiday season. One doctor told the Los Angeles Times, quote, "We're going to be New York with bodies piling up. Wouldn't be surprised if LA rings in the new year as the COVID capital of the world." And the Associated Press is reporting that 2020 will be the deadliest year in American history because of the virus. France and several other European countries closed their borders to Britain on Monday over fears of a new highly contagious coronavirus strain. The CDC warned that the strain could already be in the United States. It's been up to President-elect Biden to act as the shadow president.
Experts say things are going to get worse before they get better, notwithstanding the fact we have the vaccine. As you all know, we're averaging a death rate of close to 3,000 people a day. That means we're going to lose tens of thousands of more lives in the months to come. And the vaccine won't be able to stop that. So we'll still have to remain vigilant.
NBC News reported that President-elect Biden is consulting with scientists and experts on whether he should invoke the Defense Production Act to increase the deployment of the vaccine. Dr. Anthony Fauci received the first dose of his vaccine earlier today. As for Trump, he quit doing his job weeks ago. Joining me now are Dr. Kavita Patel, former Obama White House Health Policy Director, and Mara Gay, New York Times editorial board member. Thank you so much, both of you, for joining me. Dr. Kavita Patel, I want to start with you. A new strain of coronavirus. That's all people are talking about. Tell us what we know about this new strain so far. How concerned should we be? And does the current vaccine that's still just slowly rolling out do anything about this new virus?
Yeah, good to be with you, Jason. And here's what we know. It's a variant of mutations of the coronavirus. Can you hear me? Okay. It's a variant under investigation in the UK, which is shown to be more transmissible, which in plain language means that it's easier to give and pass along this virus and also easier to receive this virus, making it highly contagious. But it has not been linked to more severe COVID disease, which I think is critical. As for doing something about it in the United States, it's highly likely, given global travel from Europe and the UK to the United States and vice versa, that this strain might be present in the US. But the good news is that, number one, it is not associated with severe disease. So we know that while it's easy, if you still practice the measures we've talked about, that you are not likely to get it. And then number two, because we have vaccines, currently the Pfizer and Moderna vaccine, as well as several vaccines in clinical trials, which actually contain a mechanism for developing antibodies to multiple sites of that spike protein, we should be able to have coverage with current vaccines against that strain in the UK. Pfizer has already said that they're going to try to test their vaccine against this strain. But the good news is that vaccine technology takes into account that mutations occur all the time. So, Jason, we have to be vigilant. We have to keep continuing to double down on our mitigation measures, but we should not be alarmed about this UK strain. It's something to watch, but not get scared of.
And Mara, so we may know some of the technical things behind it, but we've been sort of blanketed with misinformation throughout this entire sort of pandemic because of the current president and because many members of the Republican Party. What do you think is the sort of most responsible thing for press and politicians to be doing right now about this new strain? Should they just be sort of referring us to doctors? Should they still be encouraging people to engage in the same behaviors? What's the sort of public response from thought leaders and politicians right now to hearing about this new strain?
Yeah, it's a great question. I think the number one thing is to listen to public health experts. Too many of them were sidelined for too long this year in the United States in this pandemic, and that cost a lot of lives. I think the other thing, and this is kind of a practical bit of advice from someone who has had a really tough and close brush with the disease myself as a healthy person, which is to assume the worst. I'm an optimist. I'm not really the kind of person to talk about doomsday scenarios, but truly do not assume that you know how your body will respond to this virus. Do not assume that you know that you won't give it to somebody, whether it be your neighbor, your family member, your kid, your parent, and that they'll just be fine, because you don't know how your body will respond to this virus, even if you have no pre-existing conditions. And now that we know that there's a highly transmissible strain, which I think we should just safely assume is in the United States, and especially if you live in a big city like New York, you should assume that. You should really take those precautions as seriously as you did in April, because again, the vaccine is not going to address any symptoms that you might have that are concerning.
And Mara, I want to stay with you for a minute. You know, we have these reports, we have these images of huge parties being thrown by conservative college groups and Turning Point and everything down at Mar-a-Lago, maskless parties where you actually have people like shooting out money, dollar bills, which are also incredibly dangerous and unsanitary during a pandemic. When you see stuff like that, not just as a journalist, but as somebody who has suffered through some of the impacts of COVID, does it fill you with rage? Does it make you realize that perhaps we're not sending enough messages to people? Or do you think we're always just going to have a certain segment of society that doesn't care?
It makes me very angry. I think we have a real crisis of empathy in this country, where until it happens to you or someone you love or someone you know, you don't care, or it isn't real, or it's just something that happens to someone else. In this case, unfortunately, the narrative is that this only happens to people in cities or to Black and brown people. It doesn't help when you have such a disproportionate impact on already vulnerable communities, especially minority communities and people living in poverty. And you compare their experience this year in the pandemic, not just with the disease, but of course with other impacts like joblessness. When you compare that to someone like Chris Christie, Rudy Giuliani, Donald Trump himself, who get sick, go to the hospital, get treatment that the rest of us don't have access to, and come out just fine days later, despite their age and underlying health. And so I think that does make me very angry, but it's just, I think, more fuel to just keep talking to one another and hopefully make those connections and understand that, we are all connected, whether you like it or not. And this is a virus that can come for anybody. It can come for you. It can come for those you love. And so, really it should be enough to say, protect your neighbor. But if it's not enough, at least protect yourself.
Yeah, that is a Christmas wish that we all would like to pay attention to this year. Thank you, Dr. Kavita Patel and Mara Gay. Up next on the ReidOut, more on the breaking news that the White House has issued a slew of pardons. Stay with us.